Welcome back to it, guys. The Now Morning Show continues conversations underscoring kinship and foster care here on The Now.
With the help of the Children's Authority of Trinidad and Tobago, we continue to help you understand kinship care and foster care. We've been discussing it all month long, and we continue this conversation this morning with the team lead of the foster care unit, Avion Thompson. Good morning to you, Avion.
Hi, good morning.
How are you doing this morning?
Well, thank you.
Thank you so much for joining us. Now, we brought a new maths into the equation now. We have kinship foster care. Tell me what that one is.
So, kinship, well, as you know, this month is foster care and adoption awareness month, and we've been speaking about foster care, and as you said, kinship foster care has been formalized by the authority in 2023. So it's fairly new.
Yeah.
And kinship foster care is where we look at approving foster parents, and these foster parents are kin, as you would say, and that kin meaning that they are relatives other than a parent. And those relatives can be a grandmother, a brother, a sister, aunt or uncle, and it can also be a step-parent as well.
Okay. What about like godparents? Because I know like when you go through the baptism process, the whole purpose is to say, well, if something were to happen to the parents, this person should be the person responsible for the child.
That's a good question, and it's a question that we have been getting quite a lot. And unfortunately, the legislation does not include godparents at this time, but I can assure you and the public that we are working diligently to see how we can include godparents and maybe other relatives too. But again, that's something, we are working on, and we'll definitely keep you all updated as soon as that happens.
All right. So in terms of the actual relatives then, it can be anybody who's blood related to you?
Correct, yes.
Okay. What is the difference between that and me going and spend time with my aunt when my mother gone away?
So what the difference with that, when a child comes to the attention of the authority, there's some form of Section 22 concern, some form of abuse, neglect, or abandonment.
Okay.
So they come to our attention because of that. And before if they reach to foster care, we actually try to preserve the placement of the home by working with the family, working with the children, ensuring that placement. If that is impossible or not able to work at this point in time, we then actually try to look at relatives before even looking at foster care, because relatives can approach the authority and be like, well, they were aware of the situation, they would like to care for this child, again, without the intervention of the authority, and that can also be done, and that's done via a fit person or guardianship order. But if that aspect is then not available, then again we look at kinship foster care, and we explore relatives who are willing and unable, but financially they just need that added support, which is where the authority would come in, and not just financial support, but psychosocial support as well, not only to the child, but to the foster parent as well.
So it has to be a situation where there's, you said neglect, abuse, or was the third one you mentioned?
Abandonment.
Abandonment.
Yeah.
It has to be under those circumstances in order
Correct.
for you to...
Some form of abuse for them to come to the attention of the authority, because as you noted, like within our culture, we always go by granny or tanty.
I know, saying the whole vacation you spend by somebody else. So that's not a problem. If it's your parents deciding, all right, go spend some time with your granny or your auntie, that's okay. The authority doesn't have to get involved in that.
What I would implore parents, though, whoever that you're sending your child to, ensure that it's a trusted adult as well. Ensure that you as a parent do the necessary safety checks to ensure that wherever you're placing the child, yes, it's a relative, the child is safe, you have that contact information, you're easily accessible via phone call or however, and that constant communication is kept.
All right, so you mentioned that it seems that the priority would be to place them with some family members. That's always seems to be the priority in all the conversations that we've been having. How important is that family environment as far as the Children's Authority is concerned?
Well, family is our first form of socialization. When we're born, we're infants, our guardians, usually our parents, they are the ones who nurture and teach us. And as we go from baby to infant, toddler, and we get older, that bond grows, obviously. So we try to preserve that family environment to reduce any form of added trauma that the child would exhibit, because when they come to us, they already are experiencing some form of trauma again.
Right.
Abuse, abandonment, or neglect. To further traumatize them by taking them out of a family situation, we try our best to, again, preserve that family environment with another relative. So that way, yes, there is some movement, but the trauma that the child would experience is limited. And again, with the added support of the authority, with psychosocial support for the child, we are able to mitigate as best as we can to ensure that that transition is not a tough one for them and the family.
Are there any risks involved? Because you mentioned there's abuse or neglect or abandonment in the actual immediate family, right? Is there not a risk of them still being able to access that family or the family being able to access them if it is they go and stay with a cousin or aunt or a grandparent, as the case may be?
Well, the authority, we do our checks and balances. So wherever we place them, obviously the applicant, the kinship foster care applicant, they have to go through, I don't want to say stringent, but it's a thorough process where we there's a suitability assessment that we have to do. They have to apply for a COC, and we do our checks. We go to the police station, we get that background information on the family. We also do community inquiries, and we also look at references as well before even considering that person.
So even as a family member, you still have to go through the rigorous process to make sure that you're a suitable candidate.
Yes, yes.
Tell me why was it important to formalize this kinship foster care? Because like we mentioned, it's so culturally normal for us to do it.
So why we decided to formalize it? Because we realized there was a gap in the system where we needed to ensure that we had relatives willing and able, but the gap that we realized that they were willing and able, but they needed that added support. And again, foster care was already in the works and has been ongoing within Trinidad and Tobago for quite some time. And that was a part of the legislation, and we decided, so, you know what, we needed to formalize this aspect of it and really bring it on stream to see how best we can further help the nation's children, because that's, again, one of the authorities' mandates.
Tell me a little bit more about that support that you're talking about for the kinship foster parents.
Right. So the support actually literally starts from the application process. There's a training and orientation that we do with them, so they're very much well aware of the expectations. And I want to say it's a hand-holding situation, but it kind of is, and we become a part of their village. So as I mentioned, that support is psychosocial support, not only for the child, but the foster parent as well, because some of them, again, if it's a brother or sister, it's the first time they're being a parent. So that's a new role for them. So that psychoeducational support is provided for them so that they can be able to transfer from being a brother or sister to more or less a foster parent. So that's psychosocial support, if any assistance with any medical needs. There are children with special needs as well, and some of them who have never been to school, and because of the intervention of the authority, we have 2 siblings who first time are able to actually attend school because of the support the authority has provided to that family.
You mentioned financial support as well earlier. What sort of financial support we talking?
There is a small stipend attached, and it's per child, and that stipend is to cover strictly meeting the needs of the specific child. So as part of the process, we ensure that whoever that applicant is, that they are able to meet their own needs, because the stipend is not to provide any form of services or whatever for the foster parents, is strictly to meet the needs of the child. How do you
monitor how I spending that money?
Right. So how we monitor is we have an assigned caseworker to the child, the children, and the foster family, more or less, and we do monthly monitoring, and that's home visits, school visits, we do telephone calls. Some of them can be scheduled, or we can be random pop-up or spot checks that we do. And the authority is involved in that family's life until either the child ages out, or another form or another more permanent family situation is established. Reintegration is also a possibility as well.
How long does that generally run for the kinship foster care?
It varies case by case, but again, if the child it remains in the care of that relative until the age of 18. That's the support will be provided until that time. But it's not just we even though we do stop at 18, we do provide an extensive transition plan so that the family, the child is well prepared for life after 18. So it's not
Just
okay,
drop
it's
you
at
and
18,
go.
exactly, you know. There is a process, again, and it doesn't even start from 17. It starts from 14, 15. We start, you know, I don't want to say weaning the family off, but again, preparing them for the world out there.
Yeah, so you're monitoring not just what's happening in the home. Do you also monitor in terms of their education and in terms of what's happening in that regard as well?
Yes, we also definitely do school visits. We liaise with the teachers, the deans, the principals. We really have a good relationship with most of the schools that our children attend.
How do the kinship foster care parents deal with this constant monitoring and evaluation? Do they welcome it, or do they sometimes be like, oh God, all always in my business?
I would say it's a mixed reaction. So obviously the majority, they welcome it, and some of them have been very vocal in terms of their gratitude that has been done. And the ones who were a bit apprehensive, they're now actually happy to have someone who that they can call if they're having some issues with the child, if they need support with any kind of advice with anything like that. They have that caseworker attached to them who they can call and get that added support. So they may have been apprehensive, but definitely we're part of their village now, and they welcome it eventually.
And like you said earlier, you also deal with medical expenses as well, or any medical treatment that may need to happen, yeah?
Yeah.
All right, Avion, if it is persons out there, you might know a family member who might be struggling, and the situation is a little bit tenuous or a little bit rough, and you want to offer your services, what would you say to somebody who's thinking about kinship foster care?
I would say kinship foster care, it's not an easy task, but it's a task where if you can provide that support to a relative, open up your heart, open up your home, whether it's for one day, one night, a few months, a few years, you can make a difference in that child's life. And especially, when that child is a relative, possibly someone you knew from baby growing up. Open your home, open your heart, and be that change that you can be for that child's life. And who knows, maybe you can transition to being a traditional foster parent as well eventually.
Avion, thank you so much for joining us this morning and for sharing this information. I think it's definitely beneficial to those who might be considering it, or those who may have never known anything about it before. They now know this is an option. So thank you, and thank you to the Insurance Authority for the work that you'll continue to do.
And thank you for having us.
Not a problem at all. We'll see somebody again next week.
Yes.
We look forward to it. Ladies and gentlemen, that's Avion Thompson, the team lead for the foster care unit, sharing with us a little bit about kinship care and foster care this morning. We take a quick break and come back with more on the Now Morning Show. Stick around.